Hi, and welcome to another AHA, Ask Heather Anything. I'm your host, Debbie, with help for IBS, live from Las Vegas, Nevada, and we have our one and only Heather here, live from Washington State. Hi, Heather.
Hello. Hi, Debbie.
We're enjoying this wonderful winter weather right now while we can. So I'm really looking forward to today's AHA because this is something, Heather, that's happening a lot on our community. We tend to get a lot of newbies coming in, and the people out there that are seasoned, we appreciate your comments coming in, letting the newbies know how what's helped worked for you. And now we're going to hear from Heather herself. She's been managing IBS for over 40 years. And it's really, she's taken the guesswork out of how to navigate through managing IBS. So, what we're noticing is an unrealistic expectation that comes with just not understanding. There's, it's a wide thing. Number one, I'm telling you right now, this book has been such a foundational. So the stuff that we're talking about today, if you do not have Heather's first year IBS, it's broken down right here. So this is definitely should be something that you're constantly going to. I'm constantly reading and reading and reading it over and over again.
Yeah, foundation.
So what, Heather, would you say to that newbie who has, well, first of all, just somebody who, to walk us through a couple scenarios. Number one scenario, they've been diagnosed.
Yeah.
So they do know they have IBS. And then we'll talk about somebody who is not quite diagnosed, but yet they're out there trying to figure it out like you remember doing.
Yes.
Okay, so
Well, yes.
what do you have for us?
Absolutely right, because diagnosis is the first step. That's key. You can't self-diagnose IBS. It can be tempting, and you may be able to accurately do that, but you really shouldn't. At a bare minimum, you do need to see your GI doc, a family doc, an internist. They're going to have to do some blood work. Again, bare minimum. Nobody can diagnose you just by looking at you and, yeah, you look like you have IBS. They can't do that. So they've got to run some blood work at the bare minimum to check for celiac, inflammatory bowel disease. That may be all they need to do. You might have a family history, a personal history, your age, your symptoms. You might just fit right into the diagnostic criteria. They do the basic blood work and you're done. And then you're left with the diagnosis and you're kind of left on your own. So that's where a lot of people end up pretty quickly once they get a diagnosis. That's great, I have IBS. Now what do I do about it?
Okay.
Yeah. So then you have to move on.
What do you say to that person who has that cloud over their, it's like they're in that cloud, just a lack of understanding. What would you say to that person on how to even talk to their doctor?
Someone who's been, once they have the diagnosis?
Yes.
Well, you're a little bit alone in dealing with your doc at that stage of things, unfortunately. But what I would tell the person is you're not alone in dealing with IBS. So you may feel like you've been given the diagnosis, but you're not really given answers. You have a name for what's going wrong with you, but they may not be giving you an explanation for why, for what's triggering it, what's causing these symptoms, and just as importantly, if not more, how to stop them. How do I prevent these symptoms? How do I stop them once they start? How do I live with this disorder? I have a name for what's going wrong with me. Now what do I do? So I think the number one step at that point, from my point of view, would be to reassure someone. Okay, it's actually a good diagnosis to get in some ways because it's a disorder. It's not a disease. You didn't find out that you have colon cancer or Crohn's or celiac or a bowel obstruction or countless other things that could cause the same symptoms but could progress into much worse things, could require really serious medical treatment in terms of some scary drugs or surgery or extra cancer screenings that now you're dealing with. IBS isn't going to involve any of that. So that's actually a good diagnosis in a lot of ways. It's not a disease, it's a disorder. So take a deep breath. You've learned that you don't have a lot of other serious things wrong with you, which is good. It's a bit of a relief. And now you can move forward. You know what is wrong with you. Now it's time to learn how to manage it. And I would say hang in there and have some faith You are not the only person dealing with this, and you can absolutely deal with it successfully. There's a lot of things you can do to manage this disorder so you feel like you don't have it day in, day out, and you're not living in sickness. You can live in health and have a good, happy life. So hang in there. There's a lot of support, a lot of things you can do. So don't be discouraged. You have a diagnosis, that's a good thing. Now you can move forward.
Right. So the first thing is definitely get diagnosed. Yes, we have, Dr. Google out there, and there's a lot of different communities, groups of people, and sometimes I'm seeing them come into a group and they're asking questions, and right away we can tell they haven't even been diagnosed.
Right. Right. And
Okay,
you can't do that yourself. You may think you fall right into the Rome criteria for diagnosis, and you might be right. But you can't self-screen for celiac. You cannot self-screen for colon cancer or for Crohn's or ulcerative colitis. So get yourself to some kind of doctor who can do some basic blood work, who can go over your symptoms, make sure they do fit those of IBS. It's going to be lower GI, not upper GI. You're not going to have any skin or joint issues. IBS doesn't affect other parts of the body. So it should be pretty clear cut, and you should be able to get a definitive answer that you have IBS. It's not so mysterious that they can't pin it down, and they can't, really fundamentally exclude everything else that they need to. So diagnosis first.
And you just said a major point right there about you're here to manage the symptoms, and you can manage the symptoms. This is a reality, not a fantasy. So if somebody is taking, say, they've got the gas going on, and then they say, well, what I'm taking, it's not working, so it must be that it's not working for me. It could be completely something separate from IBS.
It could. You can have other disorders and IBS at the same time.
Okay.
That's not all that uncommon. If you could have some other illness, but you actually could also have another GI disorder as well. So people can end up with both inflammatory bowel disease and IBS. Or they could have celiac and IBS.
Right.
You could have heartburn or reflux and IBS. So you may have more than one thing going on. That is completely true. But you can certainly still deal with the IBS and at least get that under control, get those symptoms really well managed. And there's a lot of things you can do quickly. There's other things that are going to take more time to resolve. But there's a lot of different avenues for help so that you can get on track and start taking control of things really from day one. The very first day that you're diagnosed, there's things that you can do to start feeling better.
And what would you just say off the top of your head is a typical, I'm diagnosed, these are things I need to start getting used to having in my life on a daily basis?
Education, I would say, is number one.
Number one.
Now you have a diagnosis, you have IBS. What does that mean?
Right.
What is this disorder? What's going wrong with my body? What is setting it off? How do I manage it? That's where I would agree with you. You're going to have to learn. You're going to have to educate yourself. What is going on? How does my body work? What's going wrong? And now all of the different ways that I can take control over these symptoms, the underlying pathology, and manage it. So I think it's going to be very hard to, try to throw a pill at something or take a medication or make a dietary change without really knowing what you're doing and how that's affecting your gut. And there's still a lot of weird misconceptions and myths about IBS and what it is and how you treat it. So I think the more information that people can get, the more education they get, the more confidence they will have with managing the disorder. And you'll know this is what IBS is and this is what it's not. It's not a buildup of toxins in my body. It's not something I can cleanse out of my gut. It's not psychological. If you just relax and stop worrying, you weren't so stressed, you wouldn't have this problem. Yeah, no, that's not the case. It's a physical disorder. It's a dysfunction of the nervous system of your gut. You need to know that so you can learn how to manage the symptoms. And so honestly, you can deal with other people in your life as well. So you have the confidence to tell them, this is what I need to do. This is what I can't do. If you'd like to know why, I'm happy to explain it to you. But, you have to have the confidence that you know what's going wrong with your body so that you can manage it. And you can do it successfully, even in the face of opposition if you're facing that. Hopefully
so number one is you need to self-educate. You need to know what is going on, and we have that information. I love, and even in the beginning of your book, you have people who have read through your book, and they talk about they've read through other resources as well.
Yeah.
And I love the fact we hear it over and over again, person after person. This isn't a coincidence. Talks about how your information in here of just A, the information, and then B, how they can use this information into their life with your recipes, with the products that you have here. It's not like you're just saying, okay, these are the things. Now go find them.
Right. Right. Yeah, you have to be able to do all of those things to learn what you need. And you're right. How do I put my hands on the things that are now going to help me? Or how do I logistically avoid the things that will hurt me? So it's one thing to have the information, but you also need to know how to put that in play, how to make that work with your life, your schedule, your family, your job.
Perfect.
So there's a ton of information that people can apply and use, and that can make, I think, the biggest difference of all.
And yes, absolutely. And people have been successful managing it
Yeah,
because of
yeah, you
that.
can be.
So Lynn has a question here. Hi, Lynn. I've been chatting with her. And I'm typoing because my keyboard's really low right now, so I
Okay.
apologize. But I'm like, Lynn, her question is, okay, great. After getting educated, what is the first recommended steps? So I know from listening to the group, listening to you, Heather, now everyone is going to be different. That is just how it is. It's not cookie cutter. It's not exactly cookie cutter. So through that education, you're going to start going, oh, this is what's going on with me, and you really dig into how you're responding to IBS.
Yeah, lots of shades of gray.
Okay.
What symptom bothers you may be different than the symptom that bothers the person next to you. How time of day, time of year, circumstances in your life that are most being affected by this may be very unique.
Mhm.
I would say one universal for just about everybody, the moment that you have been diagnosed, is take a look at your diet. Because day in, day out, dietary changes are going to make a world of difference. And
Okay.
I really don't know how you can manage IBS without following the proper dietary guidelines, no matter
Okay.
what else you're doing. I really don't think that you can just take a drug or use stress management and then go happily ever after with IBS and not pay any attention to what you're eating or not eating. That would
Right.
be an ideal world, but I don't really think that that exists. So you
Right.
really you need to learn the foundations of diet in terms of how foods physically affect your gut, because they do. And
They
what
do.
does that mean in terms of IBS? What are the things that calm down your gut and that stop spasms? What are the things you eat that increase the peristalsis of your gut and can trigger spasms? What's a GI stimulant? What's a GI irritant? How does fiber affect your gut? How do fats affect your gut? And then how do you take this information that may well be the first time people have ever encountered information like this in their lives, and what do you
Right.
do with it? How do you
Exactly.
live around that? How do I eat lunch? Now, I know these are trigger foods and safe foods. What am I having for dinner?
Right.
So that's another huge area of information and education that I think is absolutely key to people. And I would start there. Start learning how foods physically affect your gut. What does that mean in terms of what you have to eat to be stable, what you probably have to avoid completely, what you can't avoid completely, but you're going to have to eat with caution? How do you work within those guidelines so that you can eat, be happy, be healthy, have good food, enjoy your meals, not be afraid to eat, but use food to actively stop your symptoms and prevent them
Mhm.
from reoccurring? That would be the foundation that I would give to everyone. No matter what their symptoms, that's going to be kind of universal,
Okay.
and it's a huge first step. And for some people, that's enough of a step. That actually lets them
Sure.
successfully manage symptoms, and they might not need anything else. But
Okay.
start there. I don't think you
Start.
can get stable without having the proper diet in place. That's going to be
So,
hard.
are you saying that when somebody's, having gas or bloated, and they're doing the penalty or whatnot, and they're not focusing on the food per se, they're just trying to like have the penalty, thinking, okay, this says it's supposed to help with this portion of my
Yeah.
pain, of what my discomfort is, but they're not, or maybe they're just understanding, okay, I shouldn't have fried food. I think anybody who's walking on the planet knows we should not have fried food, period, no matter who you are. But they're not digging into the safe
The
foods
other
for
aspects.
IBS. So,
Yep.
so it totally kicks it right out.
Yeah, it works both ways. You're not just
Okay.
going to be able to avoid one thing and that's the magic cure. But you're also not just going to be able to, to take one thing and that's a magic cure. And a good example, I talked to a woman on the phone today, and she's been using Fennel T for gas and bloating. She's been having really great results. And this
Oh,
morning she had her cup of it, and then she got a really bad stomach ache. And she was
okay.
trying to figure out what caused it. She couldn't figure it
Okay.
out, so she called
Okay.
me. And we started talking about what she had added in and what she had taken and what was new.
Okay.
And it turned out that she had taken a high dose of vitamin C this morning.
Oh,
She felt like maybe a cold was coming on, so she kind of megadosed on vitamin C for that. Well,
thinking
vitamin
nothing
C
of it.
is really poorly absorbed by the guts of a lot of people, whether they have IBS or not. It
Okay.
can be quite a GI irritant,
Okay.
especially in high doses. Vitamin C can cause a lot of bloating and gas. It can cause spasms and cramps. It can cause urgency and diarrhea in people who don't even have IBS. So it made a lot of sense that that had really upset her gut this morning. And the fennel was like helping her feel a little bit better, but it wasn't addressing the underlying problem. She'd done something that was really upsetting her gut, and having a cup of tea wasn't just, going to be the magical solution to that. She was not going to be
Right.
able to keep megadosing vitamin C.
Right, but that's a perfect
Yeah.
example of, I think, well, think about it, we're kind of in our pattern. I mean, you get a cold, it's very common for someone
Yeah.
to respond that way
Yeah.
and to simply, do what they normally
What they
do.
would normally do. Yep. And it works
And
for other people. And why am I
why
sick?
not?
Nobody else is getting sick from
Ex
this. Yeah.
exactly.
And she'd been stable
Okay,
for a
so that,
while, so it was upsetting that now suddenly she
sure.
wasn't.
Yes.
And she hadn't actually pinpointed the vitamin C. She was thinking it was something else she had taken, but it didn't really logically make sense that it was that. So we went through everything she'd had this morning, and sure enough, vitamin C was in there.
So,
Yeah.
would you recommend that having that journal or having a
Oh, like a
documenting?
food journal.
Exactly.
Some people find that really helpful to keep a food
Okay.
diary.
Okay.
Um, it just that depends on the person. That can be
Okay.
a really helpful tool for some people. I was had that suggested to me a long time ago, and I just did not find that helpful at
It
all.
didn't fit. It didn't fit with
I
your
could
life.
never
Like it
figure
just,
it out. I
yeah.
would look
Okay.
back and think, I had 10 things for dinner. What made me
Right.
sick? I don't have any idea which ingredient it was in these foods. I can never see any, common sense threads throughout that. So that was hard.
Okay.
But for her in that situation, if things had been consistent and suddenly she saw vitamin C pop up in the morning,
Right.
yeah, that might have been a really good way for her to identify it.
Right. Right. Okay.
Yeah.
Perfect. We have some questions here. Let's see. Oh, Lynn popped in again. I see you. I'm going to go through it. There's some more. I use your cheat sheet for the food, and it's been a Bible for me.
Oh, good.
Let's talk about the cheat sheet because
Yeah.
I'm constantly, to me, I think you've done a wonderful job of laying down because it seems like when you have a symptoms, it's like, okay, where do I go? What do I need to pay attention to? You've done a
Right.
beautiful job with the cheat sheet.
Oh, good. Yeah, it's a very good, it is a really good, cheat sheet. Just a quick reference guide for people. Keep that on your fridge. Keep it in the car if you're not
In the
sure.
pocket.
Just review it once in a while. I think the more that you get used to that, the more you're
Yes.
going to see the commonalities, and you're going to be able to expand on that and just inherently recognize, oh, that's insoluble fiber. Oh, that's fat. That's going to become sort of second nature, and it will really help you to think in terms of categories
Okay.
more than in specific foods.
I like that.
Just because it's how do you run down every single food in the world?
Hmm.
So it is helpful to start thinking of your foods. Is this a fat? Is this an insoluble fiber? Is this a soluble fiber? What kind of food, much more than the
Oh,
specific food, is what kind of food is this? Where does this fit
love
into
that.
those three categories? That can really help you in terms of what you need to avoid, what you should be eating, or how to safely incorporate the caution foods, the insoluble fibers. So yeah, rely on your cheat sheet. Even if you think it's old hat and you're used to it, rely on it anyways. Just review it once in a while, and you might realize, oh, I'd forgotten the coconut's high fat, and I really
Uh-huh.
need to be avoiding that.
So this
Yeah.
is perfect because Karen's asking, and we see this all the time. So let's use this question as an example. Karen, thank you for your chiming in here. And she's from London. Hey, lovely London. So she loves the FODMAP diet. What's your opinion on apple cider vinegar and when to take it? So just what you're speaking about. So what category would you, if you're questioning something specific like that, would you start to put it in the category to start analyzing how to use it?
Sure. Apple cider vinegar is it's kind of a neutral.
Okay.
Some people find it actually helpful for heartburn or for
Okay.
reflux. It's a really traditional remedy for that, which sounds kind of counterintuitive, but it can actually help some people.
Okay.
There's no logical reason that apple cider vinegar would help IBS. but it's also not likely to be a trigger. There's
Okay.
no fat in it.
Okay.
There's no fructose. It's literally just vinegar, and most vinegars are going to be safe for IBS. The
Right.
catch is sometimes very acidic foods can bother people with the upper GI issues, so that can go both ways. Sometimes people find it helpful for heartburn. Other people can't do too much vinegar and citrus. But in general, vinegar is a nice, safe condiment, so that's one that you can use and use it as much as you wish. All vinegars across the board. They're probably not likely to affect IBS one way or the other.
Okay, wonderful. And thank you for that question all the way from London. But again, putting it into the category, that's a wonderful thing.
Yeah, it's a neutral.
It's a neutral. Beautiful.
Yeah.
Let's see, here's some more questions. Oh, good. We're talking about food. This is good. How much food should I eat at one setting?
Ooh. Not a ton. That would be the most important thing.
Okay.
You don't want to binge with IBS. You
Okay.
really don't. And it's because if you have IBS, your gastrocolic reflex, which is triggered when you eat or drink anything, something hits your stomach signals your brain signals your colon, and your colon starts contracting. And this is true across the board for everybody. But
Okay.
if you have IBS, that gastrocolic reflex is very prone to go awry, and it miscommunicates with your brain miscommunicates with your gut. So
Mhm.
putting anything into your stomach can then set off IBS. But the higher the caloric content of the food, like fats, which are the most calorie dense,
Okay.
or foods that are GI stimulants, like insoluble fiber,
Mhm.
or the sheer volume of food that you intake, all of those things are going to set off the gastrocolic reflex more strongly than anything else. So
Okay.
even
Top
if you're
three.
eating a very safe, totally fat-free, plain soluble fiber food, the safest thing you could do for IBS, if you eat too much of it in one setting, you could
Okay.
still set off symptoms. So don't overeat. You want small
Okay.
portions frequently. And
That
ideally, you're
is,
keeping your gut filled with soluble fiber foods throughout the day. So if you had a schedule and you didn't have to pay any attention at all, you would just have small meals and snacks, every couple of hours throughout the day. That would be ideal for IBS. The
and
worst
this
would be
is,
to just go all day long without eating and have one gigantic meal late at night. That would be the hardest thing
okay.
on your gut.
That's huge.
Yeah.
And that then explains why
Yeah.
it is so important to have that soluble fiber
Yeah.
going through your gut, getting it in
24/7.
there 24/7. Heather's not, she didn't make this to make fiber just to make fiber. There was a specific reason on why you created the soluble fiber the way that this is for our bodies to get it going and get
Yeah.
that flow going.
And
It's
keep
helping
it in
us.
there. You got to
Keep
keep
it
soluble
in
fiber
there.
in your gut. It only works when it's in your gut. So,
Period. That's
taking
it.
it every
Huh?
couple of days isn't really going to help you. Taking it once a day, it's going to help a little, but not as much as keeping soluble fiber in your gut all the time. Because your gut's constantly functioning, whether you're awake or asleep. Your gut has peristalsis, it's constantly going through rhythmic contractions. You're trying to keep those contractions as stable as possible. The more you get your gut filled with soluble fiber, the more it is going to force normal, stable motility, normal contractions, which is going to keep all of your symptoms under control. I don't think you can do that by fasting all day long, or even worse, going on a longer fast and then
Okay.
having some gigantic meal at the end of it.
Right.
That is going to be very bad news for IBS.
Okay. I think trigger, 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 trigger.
Yeah,
So
yeah,
stay away from that.
yeah, yeah, don't binge.
Another question here is, and actually you talked about it on our Halloween special, which I absolutely adored.
Yeah, the candies.
I was really, eyes were open as to certain things. So it says, can you list some candies? Also, check out our AHA,
Yeah.
Patricia, and Heather goes into detail about that. But
Yeah,
just
lots
real
about
quick,
candies.
just a real, the hard candy, just
The
a,
hard candy, yeah, what you're watching out with candies is fats and chocolate, solid chocolate. So anything that's a gummy, that's a chewy, that's a red vine, that's a hard candy like a sucker or a lollipop, those are all going to be your safest bets. You're going to want to stay away from the solid chocolate, anything with nuts or caramel, that's the high fat, the dairy.
Okay.
But there's lots of safe candy choices for IBS. So yeah,
Okay.
you can definitely get sweet treats.
Norma, Norma, I'm going to send you a copy of the cheat sheet. I don't want to. I'm doing a few things right now, but I'll go ahead and answer your question. I'll send Heather's cheat sheet. She's asking, "Where's this
Oh,
cheat sheet?"
oh, yep.
So I'll go ahead and send it over to
Yeah,
her.
yeah, yeah. We can post that for everybody.
Oh, I what? I can eat six. No, I got another question here. Sorry. Oh, it's already posted. Check it out right underneath. It says Eat for IBS Diet and Cookbook, Heather's Tummy Care. And right above that, there's a link. So just
Oh,
everybody listening to the AHA, it's already on there. So go ahead and click on it. Let's see here. Where can I find the cheat sheet? And there was another question. Oh, about eating at restaurants, because another testimonial I love is how people are able to go out and they're able to actually function in society.
yeah.
So eating in restaurants, of course, number one, you need to have yourself educated. It's not
Yeah,
not walking into a restaurant. I'm diagnosed. I'm going to go out with my family. How come I'm suffering?
that's
So
right.
do the due diligence. Get
Yep.
yourself educated. We have it here for you. We
Yep.
have the education here for you.
Yeah, there's
So
a reason there's a whole chapter on restaurants in that book.
wonderful.
It deserves its own separate, it's a whole separate topic of its own, dealing with restaurants. You can do it, absolutely. I actually eat out a lot. You just need, like you said, education, information about where you're going, what you're eating, how you're eating. But yeah, you can totally eat at restaurants without getting sick. You do not have to give up eating out with friends or
Beautiful.
family or on your own. Not at all.
All right. So yeah, no, this has been wonderful, Heather. I hope this AHA, we're going to title it on, the first steps that you need to do. And again, the community is so supportive. They
Yeah, they're
know
great.
if you're listening right now and you're just newly diagnosed, we know how you feel. Heather, 40 years of this, but managing it successfully. Um, exactly. And I love how in the
Yeah.
beginning of your book you talk about, you know what? First of all, take a big breath.
Yeah, right?
Take a
Exactly.
breath and know that this is what you have, and there's ways to manage it,
Yep.
and you're not alone.
No,
We
you're
are
not.
here totally.
Yep.
A little
Yep.
cough here.
Yeah, people have no idea how common IBS is. They feel like they're all alone, but wow, they are truly not. It's probably members of your own family have it and you don't know about it. I guarantee you coworkers have it and you don't know about it. It is kind of bizarre how randomly I hear from people who have IBS just because it comes up in conversation. And it can be total strangers. It can have absolutely nothing to do with talking about my business or my books or anything. Just the moment IBS comes up as a topic, people will open up and start telling you, oh, I have that. My mom has that. My sister has that. My husband has that. You can know somebody for years and have no idea they have IBS until you broach the subject first, and then, oh my gosh, the floodgates will open. Yeah. I actually found out my own uncle has IBS, and he's had it for many, many years, and I had no idea until after I wrote my first book. He mentioned it to me.
That's
If I hadn't written the books,
wow.
I probably never would have found out. But right in my own immediate family, someone very close to me who I love dearly had the same problem, and I had no idea. And
That
then it turned
doesn't
out that a cousin of mine had it as well. And
it doesn't
again, would
surprise
never
me.
have known.
Yeah, no, but people don't like to talk about it, but that's how we make
Yeah.
change happen.
Yeah.
And that's how we get support. And
Yeah.
that's why I can't thank everyone that's in this community for sharing their stories with one another, because the worst is thinking that you're the only person going through it. And
Right.
and get comfortable talking about it.
Yeah.
You didn't do anything wrong.
Right. It's not your fault. There's nothing to be embarrassed about. If you had a kidney disorder, you're prone to migraines, would you be embarrassed? Yeah,
Except
probably not. You wouldn't care.
it's frustrating, but
Yep.
there's support, and so keep the conversation going. Replay this if you're new. Listen to this AHA again, but I can't even stress that education. It's wrapped up in one place right here. As far as a
Yeah.
foundational, this is
Yeah.
going to get lay your foundation, so then you can figure out how you need to manage IBS, because everybody is a little different. So do read those comments and realize, can this work for me? Let me see how this works for me. And sometimes one thing works for one, doesn't mean it doesn't work. It's just, okay,
Yeah.
focus somewhere else then. So
Yeah, that's a really good way to put it. You have to get your foundation of knowledge, and then you're probably going to have to get a foundation of your dietary strategies. And then you may need to add on a foundation of supplements that you add in to adjunct that.
Mhm.
You may need stress management techniques on top of that. You may want to try some prescription medications on top of that. You may need one of these, you may need all of those things, and that may change throughout your life. You might have periods where you need to do more than one thing to manage IBS, and other long stretches of time where you can just use one or two things. And the person next to you with IBS might be the exact opposite. It just depends on your specific symptoms, your specific life, but there's a commonality of the foundation of knowledge, dietary strategies, supplements you can use, medications that can really be applied to everyone. So pick and choose what works for you. Have realistic expectations for how long something is going to take to help you. Some things work fast, some things you're going to have to give a few weeks to a few months. So make sure that you're managing that realistically, and mix and match your strategies and your treatments as you need to. Get as many weapons in your arsenal as you can. Use what you need. Use them all if you have to.
Wonderful.
Yeah.
So that's our stress today, is lay that foundation and get on your way. So you found the right place to figure out how to do that. So we're glad that you're here. We appreciate you, Heather. We can't say how much we appreciate what you have done for this community. So thank you so much. Sure. All right, so we're going to go ahead and wrap this up. And look forward to our next AHA. And I'm going to go through these comments. I'm glad everybody was chiming in, but somebody asked about the fiber, so we'll get that over to you. Okay. And y'all have a great day out there, and thanks again, Heather.
Thank you so much, and thank you to everyone on the community. You're all wonderful, and I really appreciate all you helping everyone else. It's wonderful to see, and you are helping other people. Believe me, you are doing more help than you realize to people. So
yes, ma'am.
Everybody should pat themselves on the back for that.
Bravo.
Yeah, double them.
Well, we'll see y'all later. Thank you.
Bye.
Bye.